Well, good afternoon. Buenos dias. We've truly had a fantastic day today here in Chicago. Thank you, Dr. Arwitty, and thank you, Dr. Ezike, for hosting me. As you heard, we started off the day at St. Anthony's Hospital, touring what is truly one of our state's safety nets. And I wanted to go there because we wanted to find out what things look like on the ground. And I'll tell you, your healthcare workers out there are busting their tails to continue to provide top-notch care. I got to meet with doctors, nurses, environmental services workers like Miss Terry, who I met over there. We got to see people get vaccinated. Luis, a nurse in the ICU, which, by the way, is at capacity, had just gotten his vaccine. And one of the things that I want everyone to know is that it's important that we take COVID seriously, but even if you don't personally feel at risk from COVID, your actions still can have an impact on you, your family, and your community in other ways that you might not think of. That full ICU, it's full because there are COVID patients pushing it over the top. But that means if you have a heart attack, there might not be room in the inn. It means if you get in a car wreck on an icy road, they may not have a bed for you. It means that if your sister or your wife goes into labor, there may not be space in the hospital for you. So it is critical that we continue this holiday season to do the things that are working. And Dr. Ezike shared with me the data from Illinois. And as you heard her and Dr. Arwitty say, we are fortunately moving in the right direction here in Illinois and in Chicago, but the numbers still aren't where we need them to be. We need to stay the course. 2 words for today: vaccines and vigilance. We should be incredibly excited about the fact that we now have 2 different vaccines authorized for use. There will be 7.9 million vaccinations that go out this week between the Moderna and the Pfizer vaccines, and we are immunizing for impact, making sure we're getting people who are in long-term care facilities and nursing homes vaccinated, making sure we're getting healthcare workers vaccinated, and then moving on from there based on guidance from the Advisory Committee on Immunization Practices and what the state and local authorities feel like is going to give them the biggest bang for their buck. The finish line is in sight, and that makes this surge different than the other surges because we know there's an endpoint. The hardest part of a marathon are the last couple of miles, but if you see the finish line, then it gives you the strength to keep going. And this has been a marathon in 2020, but the finish line is in sight, and we can't afford to stop running. So vigilance is incredibly important. We need to practice the 4 W's that I talk about. Wear a mask, wash your hands, watch your distance, and wait to gather. We know that you're doing a much better job in public settings of practicing these mitigation measures. And that's why we're starting to see these rates go back down. But we know that the virus is incredibly unforgiving. And we also know that 50% of people who are spreading this virus are doing it without any symptoms, without even knowing that they're sick. So when you have a gathering with people outside of your household, you are increasing the chance of you spreading the virus to someone else or them spreading it to you. So wash your hands, wear your mask, watch your distances when you're in public, but wait to gather with people outside your household. Now, I know I say that, and I know a lot of you will listen to me, but I know some of you are still going to gather with people outside your household. I don't want you to just throw your hands up in the air and say, oh well. I want you to understand that if you do choose to gather with people outside your household, or you may have to in some cases, that there are ways that you can stay safer. You can go to cdc.gov and on their front page, click on holiday gatherings, and there are a list of tips for how to gather more safely, even if you weren't doing the safest thing that we recommend and keeping it within your household. Things such as quarantining yourself now, because every person you interact with now is a person whose bubble has now infiltrated your bubble, and potential for you to take virus home to someone this Christmas. Things like making sure you've got plenty of ventilation in your home environment, and making sure you've got plenty of hand sanitizer and that people are practicing good hand hygiene. Again, we want you to be as safe as possible, but if you can't keep it within your household, we still want you to think about how you can have a safer holiday season. I want you to have hope, because a lot of people are fatigued. A lot of people are asking when this is going to end. And I want you to know that I'm actually incredibly optimistic, based on these 2 vaccines now being available, that we do have a finish line in sight. But I want you to remain vigilant, because it would be a real shame if we finally had the tools to end this pandemic, but then we couldn't be patient for just a little bit longer, and we lost more people than we absolutely had to this incredibly, incredibly deadly virus in certain populations. And we were so close, but we just didn't hang on. So I also want to finish by telling everyone I believe in walking the talk. And for those of you who didn't see, I got my vaccination live on TV last Friday along with the Vice President of the United States. I had a little bit of a sore arm for a day or so afterwards. That's normal. I got that after my flu shot too. But I didn't have any other side effects. I want you to know, in full transparency, that some people can have a little bit of a headache, a little bit of a fever, and that's normal. That's your body responding to the vaccine and producing antibodies in the way that we expect it to respond. That doesn't mean that there's anything wrong. And Dr. Arwitty addressed some frequently asked questions. As far as reactions, every medicine out there can cause an allergic reaction in someone. Tylenol causes dozens of people to be admitted to the hospital every day. So when we see allergic reactions to this vaccine, I want you to know they are not out of the ordinary. They are not unexpected. They're the reason why we administer vaccines in a healthcare setting and watch you. And they're the reason why we have a reporting system. And the reporting system is working, and everyone who has had a reaction so far has received treatment and been fine. The numbers that we're seeing in terms of people having reactions are not out of the ordinary or what we wouldn't expect. If you've had an allergic reaction to a vaccine before, let your health provider know. But I don't want people to be at all concerned about coming in and getting vaccinated. Again, the reporting process is working, and if you do have a reaction, then your healthcare providers are prepared to respond to it. But right now, you have a vaccine that is 95% effective. The bar for this was 50%. It's 95% effective. That means it will give you an almost complete relief of risk of severe complications or death if you get vaccinated. And the benefits are just so great to you and to the people around you that I would hate for people to not avail themselves of this opportunity because of misinformation. It is perfectly okay to have questions about this vaccine. I want you to ask questions about this vaccine. What is not okay is to let misinformation lead you into making a decision which is poor for your health or for the health of your communities. So get the facts, and then I hope you get the vax. And with that, we're happy to take questions.